You wake up at 2 a.m. again. You walk to the bathroom, half asleep. You stand there waiting. The stream is slow. The relief, partial. You go back to bed only to repeat the same thing at 4 a.m. You tell yourself, it's just age. But what if it's not? What if that small symptom is your body's way of whispering a warning? A warning that, if ignored, can quietly damage your kidneys, drain your energy, and affect the very core of your vitality? Hi, I'm Dr. Maya Collins, a board-certified urologist who spent years helping men and women restore not just their urinary health, but their confidence, energy, and quality of life. And today, I want to talk about something millions of men over 50 experience, but very few talk about: the secret symptom that could be silently signaling a serious urological condition, long before pain or blood appear. Section 1, the symptom men brush off. For many men, it starts subtly. You start noticing you're peeing more often, especially at night. The stream feels weaker. Sometimes it stops midway. Maybe you feel like you didn't completely empty your bladder. You think, it's just getting older. Or maybe, I drank too much water before bed. But here's the truth. Those are early warning signs of something much deeper, something called benign prostatic hyperplasia, or BPH, an enlarged prostate. Now, before you panic, BPH is not cancer, but it can cause real harm if ignored. The prostate is a walnut-sized gland that sits right below your bladder. Its main job is to produce seminal fluid, the fluid that carries sperm. But as men age, the prostate tends to grow, often under the influence of hormones like dihydrotestosterone, DHT. When it grows inward, it starts pressing against your urethra, the tube that carries urine out of your body. It's like squeezing a garden hose. The flow weakens, pressure builds, and the bladder starts working overtime to push urine out. Over time, your bladder muscles become thicker, less elastic, and eventually exhausted. That's when complications appear: urinary retention, infections, bladder stones, even kidney damage. Section 2, the real danger, the silent damage. You might not realize it, but that frequent urge to pee, or that weak stream, isn't just an inconvenience. It's your body's SOS signal. Visual, slow motion of dripping faucet, heartbeat sounds fade in. When urine stays in the bladder for too long, it becomes a perfect breeding ground for bacteria. This can lead to repeated urinary tract infections, which, for men, are never normal. And when backflow pressure rises, it can start damaging your kidneys, slowly, silently. This is how chronic kidney disease begins for many older men. Not with pain, not with blood, but with something as ordinary as frequent nighttime urination. I've seen men come into my clinic after years of dismissing the signs. They come when the damage has already been done, when their kidneys are struggling, or they can't urinate without a catheter. And almost every one of them tells me the same thing: I wish I'd taken it seriously sooner. Section 3. What causes this beyond aging? So what actually causes this enlargement and these symptoms? Yes, age plays a big role, but it's not the only factor. Visual on-screen list as she speaks. 1. Hormonal shifts. As testosterone declines and DHT increases, prostate cells begin to grow abnormally. Think of it as a hormonal imbalance tipping the scales. 2. Lifestyle factors. High-fat diets, lack of exercise, and chronic inflammation contribute to prostate stress. Sitting for long hours, especially in jobs that keep you desk-bound, reduces pelvic blood flow. 3. Medications. Some decongestants, antihistamines, and antidepressants can worsen urinary symptoms by tightening muscles around the bladder neck. 4. Obesity and metabolic syndrome. Men with diabetes or high blood pressure often have higher rates of urinary retention. So it's not just your age, it's your lifestyle, hormones, and even medications working together over time. Is Section 4, the overlooked symptom you might have now. Here's something most men don't realize. You can have prostate-related urinary issues without pain. Many assume that if there's no burning or blood, everything's fine. But the truth is, slow or weak flow, dribbling after urination, or waking up more than twice at night to pee, those are red flags. You might even notice subtle changes, like needing to strain to start, or feeling embarrassed because you're taking too long in public restrooms. These small signs are often the earliest indicators of bladder outlet obstruction. In Section 5, how it affects more than just urination. Now let's talk about what most men won't admit. When your urinary health declines, your confidence and energy take a hit too. You start avoiding road trips because you worry about bathroom breaks. You wake up tired because of disrupted sleep. Your partner notices you're more irritable, less energetic, and sometimes Intimacy becomes affected because of hormonal changes and discomfort. This isn't just a bladder problem, it's a quality of life problem. Section 6. When it's more than just BPH. Now, in some cases, that simple urinary issue might be masking something more serious, like prostate cancer or chronic prostatitis. That's why self-diagnosing or waiting it out is risky. Prostate cancer often grows silently. It doesn't always cause pain or blood early on. That's why regular screening, like PSA, prostate-specific antigen, tests are critical, especially for men over 50. Section 7. How to protect your prostate and bladder. Alright, let's talk solutions. Because knowing is only half the battle. The other half is doing something about it. 1. Nutrition. Eat for your prostate. Focus on anti-inflammatory foods. Tomatoes rich in lycopene, berries, pumpkin seeds, fatty fish like salmon, cruciferous vegetables, broccoli, cabbage, kale. Avoid processed meats, sugary drinks, and excess alcohol. These fuel inflammation and hormone imbalance. 2. Exercise regularly. Just 30 minutes of brisk walking daily. Improves blood flow to the pelvic area and helps regulate hormones. Bonus. It can also boost testosterone naturally. Digest bladder habits. Limit caffeine and alcohol at night. Don't hold it in for too long. And empty your bladder completely when you go. Relax and take your time. 4. Manage stress. Chronic stress increases cortisol, which lowers testosterone and worsens prostate inflammation. Try breathing exercises, meditation, or simply walking outdoors. 5. Medical checkups. Get your prostate checked yearly after 50. Earlier if you have family history. A simple ultrasound, urine flow test, and PSA can catch issues before they escalate. Section 8. Treatments and medical options. If you're already experiencing symptoms, don't panic. Treatments are effective and improving every year. Medication options. We use medicines like alpha blockers, e.g., tamsulosin, to relax prostate muscles and improve flow. 5-alpha reductase. Inhibitors, like finasteride, can shrink the prostate over time. They're minimally invasive procedures. Procedures like urolift or Resume therapy use steam or tiny implants to open up the urethra. No major surgery needed, just surgery for severe cases. If the obstruction is advanced, TURP, transurethral resection of the prostate, remains a gold standard. But remember, catching it early means you may never need surgery. Section 9. Emotional connection. The real patient stories. Soft piano music fades in. I'll never forget a patient named Robert. He was 57, retired Army, tough as nails. He came in only because his wife insisted. He'd been getting up 6 times a night to pee, but refused to admit it was a problem. Tests showed he had severe retention. His bladder was stretched like a balloon, and early kidney damage had already started. After treatment, medication, and some lifestyle changes, his life completely changed. He told me later, "Dr. Collins, I didn't realize how much of my life I'd been losing to something I thought was normal." That moment reminded me why I do what I do. Section 10. The conversation we need to normalize. Men often delay seeing a doctor for urinary or sexual issues out of embarrassment. But let me tell you this. There's nothing weak about taking charge of your health. You take care of your car, your home, your family. Your body deserves the same attention. Because when you feel better, stronger, and more in control, everything in your life improves. Section 11. Prevention checklist. On-screen graphic. Let's recap your prostate and bladder protection plan. Archer, drink 2.5 liters of water daily. Unless medically restricted, exercise 4-5 days a week. Eat anti-inflammatory, hormone-supportive foods. Avoid sitting for long periods. Limit alcohol, caffeine, and late-night fluids. Get annual prostate exams after 50. Watch for red flag symptoms, weak stream, frequent urination or incomplete emptying. Section 12. Gentle call to action. If any of this sounds familiar, don't wait. Talk to your doctor. Get your prostate and kidneys checked. And if you found this helpful, subscribe to this channel, because I'll be sharing weekly insights on how to keep your urinary system, hormones and vitality in top shape for men and women. Your health is your power, and I'm here to help you protect it. I'm Dr. Maya Collins. See you in the next video.